Good morning, everyone. My name is Anissa Rosales. I am a licensed nursing assistant, and today I will be showing you how to take manual blood pressure. Some basic supplies that you're going to need to take manual blood pressure are a stethoscope, as the one that I have. You're going to need a manual blood pressure cuff like this one. You are going to need alcohol wipes and sanitizer, as well as something to write, such as a little notebook and a pen. A normal blood pressure reading is about 90 to 120 over 60 to 80. I'm going to be demonstrating how to take manual blood pressure. This is going to be my patient. One of the first steps that I'm going to do is introduce myself. Hi, my name is Anissa. I'm your licensed nursing assistant today, and I am going to be taking your manual blood pressure. Step 2 is going to be to sanitize your hands. You're going to perform hand hygiene. This is your stethoscope. You are going to be using the diaphragm, which is this bigger part right here. You'll put your earpieces this way, pointing towards you. I am going to clean the earpieces of my stethoscope and the diaphragm. I'm going to be placing this on my patient's arm. Right here, it has arrows to let you know exactly where to put it on your patient. And you are going to be putting this on the brachial artery, which is going to be the side pointing inwards towards your body. You want to be comfortable with your pump. So there's 2 knobs. It's going to be to release the pressure and to close it. If you release it too fast, you're not going to hear anything. Your systolic is the first heartbeat you're going to hear, and the diastolic is going to be the second. You're going to be placing again the arrow on the brachial artery. So since it's on the left arm, you're going to use the left arrow. You're going to make sure it's pointing inward this way, and again you're going to tighten it as tight as possible. You're going to put your earpieces on, pointing inward, and you are going to make sure that your stethoscope is on because it can turn on and off. So how you're going to do that is place the earpieces on and tap twice. If you hear something, it's on. Mine is on. So this is what I'm going to be looking at for my reading, and I'm going to place it right here. You're going to make sure that the patient's arm is extended like this in order to get an accurate reading. And you're going to be holding your pump with your dominant hand. Turn it all the way to the right to make sure that the air is closed. So to the left will release the air for me. When you take someone's blood pressure, you take the average of a normal blood pressure and you pump your blood pressure cuff up 30 mmHgs. So instead of 120, I am going to pump it to 150 and then begin to slowly release the pressure to hear the actual blood pressure. I am going to place the diaphragm of the stethoscope right under the arrow. You're going to make sure your hand is not touching the tubing and your 2 fingers are like this, and you're going to hold pressure. You can use your other fingers to hold pressure on the patient's arm to make sure that it's tight and no air is coming in so you can hear just the heartbeat. Now I'm going to begin pumping to 150. Slowly releasing pressure. Heard my first heartbeat and my second. My patient's blood pressure was at 124 with 82 mmHgs, which is within normal range. And you're able to know that with the dashes. You will never have an odd number. It's always going to be an even reading. Make sure you take off the blood pressure cuff and put your patient's sleeve back down if you pulled it up, since I needed to put on the brachial artery. One important thing about taking manual blood pressure, it is you can only take a blood pressure such as pumping the pump on a patient's arm twice per arm. Once you have pumped it on their arm twice, you need to switch arms or wait at least 10 to 15 minutes before doing it again, because it's going to be too tight on their arm. So now that I remembered my reading, I'm going to write it down. You're just going to write it down so you never forget it, and because if you don't document something, it never happened. And the last step is going to be to clean my equipment one last time, perform hand hygiene one more time, clean my hands, make sure my hands are dry. Now I'm gonna take my equipment and put it all away and throw my little trash away and tell my patient, thank you for allowing me to take your blood pressure. If you need anything, let me know. Have a nice day. And these are some simple yet long steps, but very important on how to take manual blood pressure. So while I was performing and demonstrating how to take manual blood pressure, I missed a few things that, now that I think about it, that I wish I would have explained. One of them being the first heartbeat, the systolic. It's because I'm going to slowly release pressure once I get to that 150, very slowly. And as soon as I hear the first tick, it's going to sound like a tick, like tick. That's your the first exact tick. And then it's going to continue ticking slowly as you continue to release pressure. It's going to sound tick, tick, tick. That's when it goes tick and quiet. And that's how you know that's your last one, as soon as it gets quiet, because the heart's relaxing. And so you release the full pressure once you hear your reading. And those were the last few comments that I wanted to add to my demonstration. I really appreciate all of you guys following along, and I hope you all learned how to take manual blood pressure with me today. Thank you very much, and I hope you guys have a nice day.